Here we are live on Facebook, Dr. John, and we are going to be talking today about MTHFR and histamine, and there's a lot of confusion when it comes to MTHFR. What do I do? What are the best supplements? What are the best tests that I should be doing? What's the order of things? And what does that have to do with histamine? Is there a relationship there? I'm dealing with a chronic health problem. Maybe I have gastrointestinal problems, bloating, constipation, distension, IBS, Crohn's, colitis, or maybe I'm dealing with just not being able to handle stress appropriately. It's a chronic health condition. I talk to my doctor. They have no idea about what this is. I know more than them, and I'm really confused. I'm in a world where I hear about doing this and then I hear about doing that, and they're both contradicting each other. And now I'm really left with more questions than I started with. So tonight, Dr. John Thomas and I are going to give you a preview of what we're going to be talking about in our course. And actually, we're just going to get right into content to explain a lot of this stuff to you guys, so that you have a lot more answers and a lot more avenues to go down, so that you can unlock the mystery to your chronic health problem and get back to the life that you once had that you probably have forgotten about. And so, Dr. John, thanks so much for joining us tonight.
Thanks for having me.
Yeah, so, I basically just had a lot of questions come in during the week, and you get them too, I'm sure, and you hear some of the repeated questions. And, if someone's asking that question one time or two times, then there's a whole bunch of people out there that are thinking the same thing. So, what I thought would be a great idea, John, is talking about the relationship to a chronic health problem when someone has an MTHFR, either heterozygous or homozygous, but then they also know about this thing called histamine, and they want to know how is it related. So let's get into that. I mean, you got a PowerPoint presentation. We can talk a little bit about it, and you can just lead us right through it.
All right, sounds good. So let me go ahead and share my screen real quick, and that way we can kind of jump into this. All right. All right, so it's shared, so hopefully everybody's seeing this. So, as you mentioned, Joel, that, there's reoccurring questions that we get over and over from patients. And, most people, that initially come to me for MTHFR genetic interpretation aspects because they have chronic issues going on. And there's a handful of what I call that are deal breakers in this scenario that are things that have to be addressed first and foremost, because if these deal breakers aren't investigated or supported, properly, you can take all the methylfolate in the world for an MTHFR defect, and you're not going to get very far. Okay, so what we're going to do is talk about one of the biggest deal breakers that I see is histamine, or one's ability to control or break down histamine, as well as we'll touch a little bit on mast cell activation as well, because that kind of plays into an abundance or an excess release of histamine when the body's under stress, and then kind of show how there's a connection in terms of methylation activity and MTHFR function, that you can have an MTHFR defect, which is going to affect your body's ability to clear histamine, or you can have histamine issues that is going to deplete methylation. And so it's kind of like you got to be addressing both sides of the story. And why I call these deal breakers is because I see a lot of patients that have worked with functional medicine doctors, naturopaths, and they've done a lot of the legwork in terms of looking at the microbiome of the gut, looking at infections, looking at leaky gut issues, looking at hormones, adrenal issues, and they're better, but there's still some big missing pieces. And some of these deal breakers that we're going to talk about in our MTHFR crash course, specifically, we're going to focus on tonight, are some of those deal breakers. So if somebody's still got lingering issues, they really need to do their due diligence and investigate how some of these deal breakers like histamine are players in this. Because, like I said, if you can't control histamine and you cannot regulate the breakdown of histamine, a lot of stuff starts happening in the body. And the biggest thing the biggest problem is we think histamine, we think like allergies, then we think pollen and the allergic based response only, but histamine is so much more than that, where we can get this laundry list of symptoms that can mimic anything and everything else They can be pinpointed back to histamine excess in the body, as well as the body's ability or inability to clear that histamine. So we're going to go through and kind of talk about this. I've only got a couple slides because there's a couple diagrams that I really want to focus in on to really kind of hit home and really connect the dots, because if somebody's got skin issues, digestive issues, fatigue issues, hormone imbalances, list can go on and on and on. Histamine can be a huge factor in this. All right. So, most people, like I said, really relate histamine back to like allergy-based symptoms. Okay. And basically what histamine is basically a stress response the body gets, a chemical stress response that causes our blood vessels to swell. Okay. That causes an increase, release or trafficking of white blood cells to get to a problem. And usually what that problem is some type of stressor. It could be an infection we pick up. It could be a food component. It could be alcohol. It could be like a physical stressor. And it could be environmental aspects besides the things we know from a pollen, or some people have, allergies to like maybe secondhand smoke, or it could be like pesticide component, some type of kind of environmental stressor. All is going to cause this blood vessel swelling or constriction that's going to allow the body to get white blood cells to that area as a protective mechanism. So histamine is not a bad thing. It's actually a good thing, but it's like with everything in the body, it's about balance. Okay, so you need a histamine response, to be able to fight off these things we get exposed to. Where the problem lies is when people can't regulate that. And their body goes into this normal process of saying, all right, we're going to recognize this response, we're going to do everything we can to fight this response or this trigger that's there. But then the problem lies where now that response is in excess, or after that, the initial kind of, jump on the immune system to kind of, get after it, there's a slowdown or an inability to break down those chemicals. And now what happens is those chemicals hang around longer than they should. They accumulate, and then that's where other things set in. And typically those things that set in are chronic symptoms or chronic issues that people are continuing to seek answers for. And so we're going to kind of really try and connect the dots on some of these things tonight. All right.
Hey, and John, just mentioning that slide before, if you can go back for a second. I think a lot of people look at the food component and the environment component on that, right? And they understand that, but they don't look at the physical stressor and the trauma and the activation of mast cell based on perceptions, right? And based on relationships and based on jobs and finances. And if they're overwhelmed and they're focusing on the MTHFR, and I don't get it, I'm doing all the things that I need to, but then they keep going back to the contaminated relationship that causes the activation. And then I don't think they think too much about, maybe alcohol from hey, it's not so great for the liver, but they don't look at it from sort of the aldehyde component of things. And then infections, it's one of those things where a lot of people are asking me, John, hey, do you guys look at reoccurring Epstein-Barr viruses? Do you guys look at multiple chemical sensitivities? And definitely, listen, that's what triggers and causes the enzymes that may be predisposed in terms of how well they're functioning to be worse or be the perfect storm. So I really think that this course is not just going, and what we're talking about tonight is not just talking about MTHFR and talking about foods and environment as it relates to histamine. It's putting all the puzzle pieces together where you may be, like John said earlier, you're doing a lot of good foundational work. It's not all for naught, and I want you guys to realize that you guys are doing a lot of foundational good quality stuff, but it's like anything, if you're looking to lose weight and you're 100 pounds overweight, that first 40, 50 pounds might be easy based on just not being so blatant with the things that you're doing with cheating and not moving and being stationary. But it's that last little bit that's going to really require some really focused, customized recovery strategies. And that's really what we're talking about. So John, I just wanted to mention that.
Yeah, and you're exactly right. Everybody's doing so many things, but it's like they're missing those last couple pieces of the puzzle that's going to complete the picture. And kind of what you first said is, a lot of people, it's like we're able to pinpoint the environmental and the food stuff, because a lot of times it piggybacks that there's an acute based response. There's an immediate response where we know that, hey, we ate this and we felt this way, or we got around too much pollen or a chemical component or secondhand smoke, whatever it is, and we notice an immediate response. So a lot of people can make that connection, but sometimes it's those other things that accumulate. And when I talk about histamine, it's like in a bucket of water. Okay, and what happens is if you're filling that bucket of water up faster than you're taking the water out, eventually that water is going to spill over the edge, and you've got all that water on the floor, and you've got a mess. Okay, and from a genetic perspective, people that have a lot of weakness in the ability to either regulate histamine in the gut or break down histamine when there's that stress response that happens, or they have mast cell activation syndrome where they're weaker genetically, where their mast cells would degranulate, and just whenever that stress happens, they're just going to dump an abundance of histamine into the system. When people have those issues, what happens is they start putting water in that bucket a whole lot faster than they're getting out, and then they do this or this, and it's not enough. It's almost like we're putting a whole cup of water in the bucket, but we're taking a teaspoon out. You're not getting very far, and that water's still spilling over the edge. And that's why I say that histamine is a deal breaker. And this is something that is an issue with people. And there's some of these genetic factors that we'll talk about tonight, and you address them properly, you get to the point where now you're always going to be putting water in the bucket. So it's the world we live in. But now you're putting water in the bucket, you're putting 1 cup in, but you're taking 2 cups out. And eventually that water level gets below the bucket line, and the water starts spilling over the edge, where you got a mess on the floor. And now what happens? You get control back of your health. Okay, and this is really what it comes down to is finding out those couple missing pieces, everything that people are already doing, and fine tuning this and finding what those missing pieces are. If we're talking about histamine being more than just sinus and allergy aspects. There's a lot of function of histamine in the body. There's the immune response, which we kind of already talked about in terms of, white blood cells rushing, stimulate white blood cells to kind of rush to an area that needs it. Histamine helps in terms of controlling inflammation. You need histamine and control of histamine for proper digestion. Blood pressure. I've seen numerous patients with blood pressure issues, and we control histamine. It's like all of a sudden now they're over medicated. Their blood pressure, drastically dampens down. Muscle contracture. I've seen many fibromyalgia patients that have done anything and everything, and they're on medications like Lyrica and gabapentin just to control pain. And you start taking care of histamine, and the muscles relax and pain modulates down. Okay. Body temperature regulation. Somebody comes in, has, I've got cold hand and feet, and we think, okay, it's thyroid or it's iron issues. Something that can go back to histamine, especially if your thyroid's normal or your iron levels are normal, or you're doing things to support those, and it's like the temperature regulation things just aren't changing. Wakefulness, and this where it comes into like fatigue issues. People that have fatigue or depression or other components. Histamine can be a huge factor that just really sucks the life out of you day in, day out, and can affect how your brain functions. Because we know that when we talk about methylation, MTHFR activity, and this is something we won't get into too much tonight about over and under methylation, how histamine kind of like is an inverse kind of marker that can indicate that. But a lot of times, if you have high histamine, you're going to typically be under methylating, and typically with that, your serotonin levels are going to be depleted. And so if your histamine's high, your serotonin typically is going to run low, and you're going to have mood issues. Okay. And so histamine is a huge component in terms of modulation of our neurochemicals, because histamine is also a neurotransmitter. It signals one neuron to the next. And so histamine has a lot of functions of the body. And then another thing is, I'm fortunate I get to see a lot of fertility cases as well. So I get these females coming in that haven't had a cycle in months, and they want to get pregnant. So sexual hormonal function is a big keyword. Excess histamine can really disrupt those normal feedback loops from the brain, specifically the pituitary, to those end organs like the thyroid, adrenal, ovaries, uterus, prostate in men, things of that nature, testes in men. So histamine can be a huge disruptor of a lot of things when that water level is spilling over the edge.
Hey, John, just real quick, because a lot of people, one of the things that I mentioned to them was not getting too much into it today, because I think just as a deal breaker itself, histamine and everything you're talking about needs to be the priority. But you just mentioned if we can just sort of explain it one more time. So with histamine, what will happen if someone is producing too much histamine, then that's considered sort of an under-methylation, which sucks up some of the serotonin. Can you explain that just a smidgen for us?
Yeah, so this is something that people that I work with maybe come in because there's a lot of things out there in Dr. Google world, but and this isn't always an exact component, but you can get about when we talk about under over methylating. So when people have MTHFR issues and they get out there and they start researching things, we kind of see this as questions that come to us or people on Facebook forums or different blogs that write comments and saying, okay, how do I know if I'm under or over methylating? Basically what that means is you're either putting too much in the tank or you're not putting enough in the tank, okay? People that typically are over methylated typically are overstimulated, okay? Almost like that methylation process is working too fast and then loading up on the B vitamins may blow them out of the water. Undermethylated, just like they can't put enough gas in the tank. The MTHFR issue is relevant. They can't convert folate into methylfolate to kind of drive the methionine or methylation cycle, be able to make hormones, make brain chemicals, make antioxidants, make DNA. The list can go on and on and on. But there's this correlation that if somebody has high whole blood histamine levels, okay, they typically are going to trend to be a undermethylator, okay? And then the opposite of that, if somebody has low histamine levels, all right, they are typically going to be an overmethylator. So there is this indirect relationship between methylation activity and histamine levels, and it kind of makes sense because, if you have high histamine, okay, we're going to talk about this connection here in a second about you need methylation, you need MTHFR to be working properly, and if you've got genetic issues where your MTHFR gene is coding for enzymes that work a little bit slower, and now you've got a decreased ability to convert folate into methylfolate to drive methylation activity, what's going to happen? Histamine levels are going to accumulate because you need methylation to break histamine down. All right, so that's where that connection is. And so, I run blood markers that I look at histamine levels, I look at zoning levels, I look at DAO levels, and you kind of see reoccurring patterns with this where somebody's histamine levels are high, their zoning levels are high, their DAO levels are low. We'll get kind of into those terms here in a minute, in a little bit. But typically it's somebody that, is fatigued and depleted, from an energy standpoint, they can't detoxify because they can't make enough glutathione and push other detox pathways effectively. So the reason there's that correlation between histamine and methylation is because you need methylation. You need MTHFR to be working properly to be able to break histamine down. Okay, and if it's one of those things where everybody's saying, I've got an MTHFR defect and I need to take methylfolate, which you maybe do, because if histamine's a problem, you can't just work on breaking histamine down. You got to support methylation, because if not, you're not going to get very far, because there's always going to be an inborn issue in terms of how you can break histamine down. Now, when we talk about histamine as a deal breaker, sometimes you got to get in and get more aggressive to get that water level down, because what happens is if you start pushing the methylfolate and there's some other issues in some other stories you're working about, it may not work as effective as possible. You could have issues in your urea cycle. You could have issues in terms of sulfite clearance. Now you start pushing methylation, and you can start having other issues, and you're not making a dent into really controlling the histamine. And that's kind of some advanced kind of concepts. But the biggest picture of this with this whole talk tonight is the MTHFR and the histamine is like they go hand in hand. They really do, because you need adequate methylation as a piece to control histamine once it gets outside the gut, once it starts accumulating in the cell, to be able to break that down so that, like I said, you stop spilling water over that bucket's edge onto the floor and continue to have a mess day in, day out.
Right. So bottom line is, as you go on here, where this topic is actually really great is that people are so focused on MTHFR, but if they're not asking the question, like what's going on with histamine, it really sort of puts MTHFR in a little island and thinks about nothing else impacting it except the fact that you have an enzyme that doesn't convert properly. And you really got to start thinking about these relationships and how they impact each other so that you can understand the whole layout, the whole blueprint, to be able to make those 1 or 2 degrees of distinction to get your health back, really is what we're talking about.
Yeah, absolutely. Because a lot of times everybody gets so focused on MTHFR, and if histamine is so out of control and you're taking, a specific amount of methylfolate, it may not be enough to make a dent into the methylation activity that's needed to break histamine down. Okay. And so what we're looking at here is this is a simplistic kind of breakdown of histamine. You get histamine from an amino acid called histidine. We get histidine, from food sources, things of that nature. But then histamine is actually broken down two ways. Okay, there's a couple other pathways, but these are the two main ones that everybody talks about. And the first one is more in the gut. Okay, and the gut one is let me get this point. So the gut one is over here. Okay, and this deals with food comes into the system, and you have an enzyme called diamine oxidase, and its responsibility is breaking down histamine from the foods that we eat. Okay, and then that's further cleared out. Now, genetically, a lot of people have genetic weakness in the gene that makes DAO, or diamine oxidase. And where the problem lies is a lot of the things that people are doing out there in terms of leaky gut diet, the SIBO diet, ketogenic diet, maybe they're doing something to try and heal their gut and they're eating a lot of fermented foods. A lot of the foods on a majority of the dietary things out there that a lot of functional doctors are putting people on tend to be higher in histamine. And if people go into this where they've got chronic issues and that water spilling over the edge in terms of histamine control, and they're doing a diet that is high in histamine, or they're doing bone broth, or they're doing kombucha teas and things of that nature to heal the gut, and they have a genetic weakness where they can't make enough DAO enzyme, well, they're not going to break histamine down. Some of that histamine is going to get absorbed, and then further going to fill the bucket up faster. Okay, so that's one of the main pathways, and we're going to talk more about this tonight. As a key player, because this is kind of the starting point. So we talk about functional medicine. Everything starts with the gut, if you can't control the histamine levels in the gut and you're just focusing on methylation activity, it's like you're still putting water in faster than you're taking it out. Okay. The second pathway, which deals with methylation, is over here. So the second pathway, which deals with an enzyme called histamine N-methyltransferase. Okay. And this enzyme breaks down histamine once it gets outside the gut, and breaks down histamine inside of our cells. So our cells don't swell up and just dump more histamine into the system, which is kind of fills that bucket up at a faster rate. It's dependent on SAMe, okay? And so to make SAMe, which is the body's primary methyl donor, and behind ATP is actually the second most produced chemical in the human body, it needs methylation activity, okay? It needs MTHFR, it needs methionine synthase reductase, MAT genes to convert methionine into SAMe. So to be able to break down histamine through this pathway here, when histamine's in our cells or outside of our gut, you need adequate methylation activity. And the whole we're talking about, you need adequate MTHFR function because you need to be able to make SAMe. Because if you can't make SAMe, you're not going to break histamine down, okay? So there's two sides of this. Yes, you need to support your MTHFR, but the thing is can you support MTHFR methylation enough to be able to take water out of the bucket faster and put it in? But the elephant in the room and the deal breaker component a lot of times is over here in this pathway that deals with the histamine regulation at the gut level, okay? So we need adequate methylation to be able to break histamine down, but we've got to kind of remove a source of this in the first place, so we're not putting water in faster than we can take it out, okay? Now, to further kind of add down this pathway, then we need to go through an enzyme called MAOB, and some people in genetic reports know about this because, this deals with regulation of certain neurotransmitters, and it's dependent on riboflavin, okay, vitamin B2, or the active form of vitamin B2, FAD. And FAD is also a cofactor for MTHFR. So sometimes what I see a lot is running organic acids tests on people, micronutrient tests on people. A lot of people are deficient in vitamin B2 because their body's maybe just burning through it because they've got MTHFR defects and they got increased histamine, that their body is trying to control the story and they're just depleted. I noticed with some recent articles out there about your MTHFR defect is actually a riboflavin deficiency and a B2 deficiency. Well, yeah, because your body's probably burning through it because of the MTHFR, because it's one of the primary cofactors that MTHFR needs to make methylfolate. But then you've got some key pathways that are also dependent on FAD. And in a lot of people I see, this histamine story is out of control. And Joel, I'll tell you, in the patients I see, you know, because I'm usually the last doctor of the party, they've already worked with other functional medicine doctors, and they're coming to me because of, you know, my kind of expertise in this genetic stuff, is the histamine component is not being controlled how it should. And the thing is I'm being generous with saying this, that I would probably say about 50% of the people I sit down with, this is a problem. Okay. And that's being very generous in terms of saying that many people. So pretty much every other person that I see that has chronic issues, that there's still pieces that are missing to this, this is a story at some level. And like I said, that's being generous, because I'd probably say it's probably closer to 80%. And we're not even talking about mast cell activation, because I think that is something that's completely misdiagnosed or underdiagnosed. I think it's a bigger problem than it is. And that's something for another talk. But this is huge. It is a deal breaker, because you can take all the methylfolate you want in the world. If you've got a DAO deficiency, it's not going to make any difference. Or if you can't take enough methylfolate to control all the histamine coming into the system, it's like you're taking one step forward and two steps back. You're not going to really accomplish much. You got any comments on that?
No, it's awesome stuff. I think that what you're talking about is really, really necessary. I mean, I think what people will learn when we do the course is we will show them, okay, these are the top 10, top 15, top 25 genes that we feel are the biggest factors and players. And then we'll start to build the puzzle as to, okay, where do they fit in? And then you'll see that they fit in the histamine story. They fit in the repairing cell membrane story. They fit in being able to make your neurotransmitter story. But most importantly, where do they fit in with your specific chief complaint, right? Because it's not a cookie cutter formula. By definition, genetics are individual. But at the same time, we need to relate it back to what is it that's not working with you. And then let's look at the genes that are the biggest usual suspects in these sort of assembly lines of producing widgets, if you will. And then we can see, you know, okay, worker number 3 in this chain is not working so well, and that worker needs these nutrients, and these are tests that we would recommend you look into to see if that's a problem, and really give you as much as possible, I guess, a recipe, or at least I call it one of those do-it-yourself stories, right, John, where you have kids and it's like, okay, do I choose for this person to go to upstairs and go into the attic, or do I choose them to go downstairs and go into the basement? And sort of you can kind of build a story based on which direction you want to go, and that's customized to what's going on with your own health. And I think that's really what we're going to be teaching you in this course outline that we're doing.
Yeah, absolutely. So, you know, this, I'm just going to touch on this picture I kind of posted here, because this kind of just, you know, shows, and this is a research article that pulled from PubMed, and it really just kind of shows that, you know, everybody kind of checks off that histamine deals with respiratory issues, the congestion, breathing components, things of that nature. We always kind of attest it to like an allergen triggering kind of an immediate response. But this kind of goes into some of the components that we see, you know, with skin, cardiovascular, brain function, bone marrow, immune function, GI, hormonal components, you know, that just kind of drives home. These are some of the symptoms that people can experience. You know, they can have vertigo issues, they just aren't responding. You know, they can have headaches, they can have hypertension issues, they can have, you know, skin issues where they flush, or they have outbreaks, or some type of like eczema component. You know, they can have dysmenorrhea or amenorrhea, where they have, you know, their cycles just really erratic or non-existent, and they're trying to get pregnant, or they've had reoccurring miscarriages, and it's like all everybody's doing is maybe checking their iron, the thyroid, and MTHFR. It's a complete injustice. You got to look at the whole story. You know, gastrointestinal issues that really kind of pin back to the DAO enzyme deficiencies that we'll talk about more here in a second. You can digestive components, and here's the thing: is things like SIBO and leaky gut. It feeds this story, you know, and it really kind of drives some of these things home. This is a diagram I love, and this is the only thing I'm really going to touch on mast cell activation tonight. And basically, what mast cells are is they're a cell, and one of the functions that they do is they store histamine. And some people are genetically predisposed that their mast cells have a tendency that when their body gets under stress, they will degranulate at a more rapid or easier rate and just dump excess histamine in the system. Okay, so the histamine control or burden is out of the mix. This was a great chart that Bob Miller from the Nutrigenomic Research Institute put together, and it really kind of drives home not only histamine and mast cell component, but some of the epigenetic factors that can play into this and feed this. And so this middle part right here, really is huge, because what happens is, people get stuck in this row with chronic issues, and it's like good days, bad days, and they feel like they're not getting anywhere, and everything at some level goes back to inflammation, okay? And you've got this vicious cycle here where you have inflammation or mTOR, which we won't get into that tonight, but mTOR and autophagy is another kind of deal breaker in this. But you have inflammation due to different things, due to environmental components like pesticides or iron issues or diet, MSG. There's things that can kind of feed in and drive inflammation, and then inflammation is going to create tissue damage, all right? And then that tissue damage in turn is going to activate or stimulate mast cells to produce histamine. And then from there, you're going to have a histamine release and an immunological response, and that further is going to drive inflammation. So you kind of got this vicious cycle going on here, okay? What's great about this is we know that there are certain, epigenetic components or stressors that drive inflammation. We also know there's things that drive mast cell. And some people that have a genetic weakness where these mast cells break apart and just dump histamine are people that are the sickest of the sickest sometimes, okay? And you can have EMF issues, Lyme, you can have estrogen dominance, you can have virus issues like Epstein-Barr, like you mentioned in the beginning about questions we get, how do you go after that from the genetic standpoint? There's a lot of things that drive that mast cell activation component. And then you get the histamine from foods that can drive this mast cell. And so really what happens is the mast cell and histamine component, it drives inflammation. And then that inflammation causes tissue damage, and that in turn is going to create more mast cell activation and then more histamine. And so, MTHFR is vital, methylation activity is vital, but then you have to get after those epigenetic components and figure out what are those stressors. And some people already know what those stressors are and are doing things about it, but maybe they're not controlling histamine or mast cell in this story, and they've got this vicious cycle that continues to go on that is huge, okay? And this is kind of a thing that we in our course are putting together is, we're going to spend a lot of time on this because, like I said, this is a deal breaker. And if you can figure this out and you can stop this vicious cycle happening to yourself, this is where people get better, and they get better quickly. Okay, and it's very exciting when we figure out that this genetic component with histamine is there, and now you do something different about it, and now it's like they start trending in the right direction at a rapid rate. It's very enlightening, very exciting for me as a practitioner, as well as them getting their life back. Any questions about this, Joel? Because this is something we'll talk about over and over, this slide that Bob Miller put together. I got some tangents off of this that I put together that are huge in this. But I want to, if you don't have anything to add to this, I want to kind of get into this DAO gene and this gut histamine, which is that first step of being able to really control histamine. And we talked about this on previous, Facebook Lives and everything, but I want to talk about it again and kind of really drive it home because you could be thinking all the methylfolate in the world you want for an MTHFR, but if you cannot control histamine in the gut, you're going to be putting water in faster than you can take it out. And methylation support isn't probably going to be enough to get ahead of controlling this histamine story.
Yeah, I mean, the only thing I would add is that it's really deep, confusing stuff. But what I would say is that it's kind of like an all or none. And once that first domino effect happens, and there are certain things like vicious cycles where one thing creates, its own reproduction because it started that circle of dominoes that are continuing to cause each others to fall down. The bad news is when that happens, you're dealing with the chronic health problem that a lot of the times and thousands of dollars later and years go by and experiences in life get missed out on. It can be super debilitating like no other. But the good news on that is once you stop or remove one of those domino pieces, just like you know, a domino falling and just like physically seeing them, it's not going to fall any longer because you don't have that initiating trigger that causes the vicious cycle. And like what John's saying in return is, once you remove that, it comes back online very, very quickly because you've been doing a lot of other things that have been foundational, that you're just so close yet so far. And I think that's the take home on this is, yeah, this is confusing stuff. And I'm concerned that if I take this course, I'm just going to be more confused. And really it's not going to work that way, because we're giving you more insight on the vicious cycles that you can remove one or two dominoes and really have such a great impact. And that's really what John is saying.
Yeah. And like I said, sometimes it can get overwhelming, but sometimes when you hear it multiple times, hear it different ways, and you start getting a foundational understanding of this information. And really the take home point with this is, those that have MTHFR, issues, when they first, were told about the MTHFR, they had no idea what that meant. And they went and they did some research, and they got a pretty good understanding of what that means and what they got to do about it. So this information is probably new to a lot of people, histamine control, mast cell issues, things of that nature. So what I want to do now is kind of get into, a starting point that people can actually get after in terms of things they can start doing to start addressing this in terms of the first step that I see with patients that you got to do to start controlling the histamine issue. Yes, supporting MTHFR and methylation is vital. It's huge. But the thing is if you are not controlling histamine at the gut level, you're not going to get very far, okay? Most people are familiar with what leaky gut syndrome is. And basically the number one reason why people's guts don't heal is because of this histamine story, because there's a delicate balance or relationship between histamine and a protein called zonulin. And so basically all zonulin is when you have high zonulin levels or issues with zonulin, that's how the gut becomes leaky. All right. Basically, zonulin opens up the doorways, and now things can cross through the gut that aren't supposed to cross, and that's what a leaky gut is. And so, if the zonulin levels are high, histamine levels are usually high. And so why that is because if zonulin or if histamine levels continue to stay high, what it's going to do is it's going to keep those zonulin levels high, and then the gut is going to stay leaky all the time. So one of the things that people can do as kind of the first step in this, okay, and we're going to talk about this first step tonight, that they really need to investigate and do before they really even say, all right, how do I really push the methylation activity with the MTHFR defect to start addressing the histamine levels? Yeah, that needs to be done, but this is the bigger piece. This is the first step, okay? So there's these genes, these ABP1 or AOC1 genes, okay? And people have mutations in these genes, and they're not really common, but they are common. And we talk a lot, Joel, about traffic on the highway. You could have no genetic variants and be having a boatload of histamine that's hitting the system. That could be enough an issue. But the people that have these ABP1 genes, like I said, that's where this deal breaker concept comes in play, because they are going to have a decreased ability to make the DAO enzyme. Okay, so the ABP1 gene makes DAO enzymes, diamine oxidase, and what diamine oxidase does, like we already talked about, breaks down the histamine from the foods we eat. Okay, one thing I will say about this is there's genetic reports out there that have these ABP1 or AOC1 genes on it, and people are understanding those reports also have a gene on it called DAO, right? That DAO gene on those reports is not the same DAO we're talking about because of the ABP1 gene. So when you're assessing the gut histamine story, you want to be looking at these ABP1 or AOC1 genes, not the DAO genes that are in those reports. I get that all the time. People will sit down, like, I've got these DAO genes, I got an issue with histamine. Like, that's not the same gene. We're not talking about the same story. The DAO gene works in the brain on some different mechanisms. So if you've got 23andMe or Ancestry, some other test, these are the genes you're going to want to look at to see if you have mutations in those, which is going to indicate that you have an issue with diamine oxidase. And so then what are you going to want to do with that? You're going to want to consider a moderate histamine diet, and you're going to want to supplement with DAO. Because if you have a genetic predisposition where the gene doesn't make enough DAO enzymes, you've got to replace those somehow. And there's some products out there that do that. Zymogen, Neurobiologics, professional health products. There's a couple of companies that make products, supplements that have these DAO enzymes in it that you can take prior to meals that are going to help you break down the histamine from the food you eat. All food has histamine, all right? There's a variation in terms of how much histamine are in particular foods. There's tons of lists out there, something you can easily Google. And then there's foods that promote the release of histamine as well, like chocolate. Really not a high histamine food, but it produces the release of histamine for mast cells. So, if you have these genetic variants, you need to consider a moderate histamine diet. So you got to get away from the fermented foods and the bone broth and kombucha tea. Doesn't mean you can't have them. It just means you have to have them in moderation, and you have to take the enzymes prior to taking or eating those foods or drinking those drinks, because you can't control histamine, because there's a likelihood that there's a deficiency that's there. Now, this is what they look like in genetic reports. So this is an interpretation component. The first one, the top one that ends in 793, that is the big one in the research. Okay, so it's really the primary one in these ABP1s, and then the second one down is the second one. So this patient right here is actually a patient I consulted with actually yesterday, who's got fibromyalgia, Hashimoto's, type 2 diabetes, kind of a laundry list of issues. Gone through leaky gut, worked with alternative doctors on gut health, and just has been missing pieces. So we looked at genetic aspects, and she's a train wreck. The primary one, the 793 location, she's got 2 mutations. So she's got genetically, she's got a real high likelihood that she cannot make enough diamine oxidase. And then the second biggest player in there, she's got 2 mutations on that as well. So she's homozygous there as well. And guess what? We ran a test from Dunwoody Labs called the intestinal barrier assessment test, which looks at histamine, zonulin, DAO. And guess what? What the test showed is her histamine levels were through the roof, her zonulin levels were through the roof, so she had leaky gut, and her DAO levels were pretty much non-existent. Okay, so that is something that is going to change this lady's life, because our first step is we got to get in and control histamine. We got to control how her body can break down histamine in the food she eats, and how her body can regulate all this other, histamine outside the gut, because she can do all the stuff in the world in terms of B vitamins, all things she's done. Genetically, histamine is going to overtake. That water is spilling over the bucket's edge like Niagara Falls.
Yeah, let me just say too, she could be the person listening to this that didn't see you, and I don't know, what was she for MTHFR? I mean, let's just like hypothetically speak, what was she for like the 2 different copies of
She was compound heterozygous, and she was taking methylfolate. Been taking methylfolate for a couple of years.
Right.
A1C is like 6.8, 6.9. Just nothing's, being regulated, fibromyalgia, pain, Hashimoto's, it just, it's a laundry list of supplements. And it's like, why are you taking these things? It's like, well, a couple doctors over the years put me on them, and, I don't know if they're helping me, but just based on labs and stuff, I'm like, yeah, there's some really great things you're taking. But the thing is it may not have as much of an impact, because of this histamine story in her is literally out of control. Okay.
Right.
And not the genetic component, but now we got laboratory components that confirm that, and we start changing that story on her. Things are going to improve. They're going to start trending in the right direction.
Yeah, and the frustrating part on her end too is I don't get it, Dr. Thomas. I'm gluten-free. I'm removing all these foods. I'm taking my methylfolate, and it's just, I don't think it's working. Well, yeah, it's not working because you're in the wrong arena. You're not in the area where the flood is, and you're mopping up the floor in somewhere else that's not really contributing to the main story. So
yeah,
that's
absolutely
right.
Yeah, absolutely. And the thing is, I'm passionate about this genetic stuff because my wife's got actually 3 copies of the MTHFR gene, or the worst one I've seen. Her and my kids have variants in these ABP1 genes. My son, he gets those allergic shiners under his eyes when this is something that's not really controlled. So I can like see that, like, in a day, like, oh, wow, we got to bump up the histamine support for that. I don't have any mutations in this personally, but I still take diamine oxidase enzymes because I tend to eat a more Mediterranean and shift into ketogenic. So I tend to eat a higher histamine diet. So, hey, my wife and my kids are taking these diamine oxidase enzymes. I'm like, I'm going to take them too and see what I notice. I actually notice a big difference when I take them versus when I don't take them in terms of how my digestion, how my energy levels are. And so it's something for me. I don't have the gene variants, but I got a lot of traffic on my highways based on my dietary components. And now pollen season is going to start kicking up here and already is kind of in the Atlanta area. So it's like I'm always, and I used to have a lot of allergy issues prior to getting into this. Really don't have that anymore, but taking the diamine oxidase enzymes takes that to another level. So you can, and the point with that is you can still have no genetic variants, but you can have a lot of traffic on the highway, meaning a huge histamine burden or mast cell activation, and you want to start kind of dampening the histamine load in the gut so that you kind of slow down how much water you put in the bucket. This stuff is so life-changing when these things are there, but it can be life-changing even when they're not. And that's why I said they're deal breakers. And Joel, I've been telling you this for a little while. There's a handful of deal breakers that are starting points that if those things are going, those things are affected, people are not going to get control of inflammation, and you can support MTHFR all you want, you're not going to get very far. And I started in this based on MTHFR, and just realized real quick there's a whole lot more to this, and there's a whole lot more rabbit holes you got to go down. And that's what we're doing in these, in these Facebook Lives, and is kind of bringing these things out there so people have a better understanding. And then we kind of package this in our MTHFR course to really kind of delve this in and hold somebody's hand through this. Like I said, this information can be so life-changing for people. And I hope some of the people listening kind of, take it upon themselves to do this or ask their doctors to investigate this story, to figure out, do they have these genetic variants? What are their histamine and their DAO levels? Because, if those things are players and it's not being addressed, there's going to be a big block or a big hurdle that they're never going to overcome.
Yeah, I feel like the time is now, John, where the MTHFR is like the 1.0 version, right? And now we got like the upgrade in the 2.0 version where it's like, okay, well, now let's put it into action. And how does it impact people that have a chronic health condition that gluten-free diets aren't enough, taking folate isn't enough. But let's actually look at all of these relationships. And so let's just kind of, unless you got more to talk about, let's give them an idea on our course. Or do you have anything else on your presentation, John?
I'm not sure. Let me check here. No, just kind of just a little bit follow up on the leaky gut side of things. And it's kind of already talked about this where, a lot of people have recurrent leaky gut issues, and it's like they really kind of get their head wrapped around that. And it really just kind of some more information about, the missing piece to leaky gut is histamine control, and unfortunately I've consulted for certain labs, and one of the labs I consult for has a really, really good gluten and leaky gut test. And so people go through leaky gut protocols and you don't see the gut heal. You see their zonulin levels still high. And we've probably in the last maybe year and a half really pinpointed why that is. And it's the people that have these ABP1 gene variants and a deficiency in diamine oxidase because they can't control the histamine in the gut, which is going to keep the gut leaky. And so everybody says, oh, your symptoms are due to leaky gut. Your fatigue, your hormones, your neurological symptoms, your pain levels, your child with ADHD is due to leaky gut. All we got to do is heal the gut, get the, you got SIBO as well. We got to get the bad bacteria out and repopulate with good bacteria. But the thing is a lot of reasons why that stuff is there and not healing, or maybe in the first place, is because the histamine story is not being controlled. That is driving that gut from being leaky in the first place, because the doorway stays open 24/7 if you cannot control histamine levels from the foods you eat.
Right. Awesome point. And that talks about that one slide too, where most people understand the foods and the environment, but not necessarily the alcohol or the stress or the infections, and all of those need to be addressed as well. So what we're doing is we're putting together this 6-week crash course and giving you PDF handouts, questions to ask your doctor. The bonus themselves, the MTHFR Facebook group that we're doing, that will be able to ask questions for Dr. John and myself on Thursdays for 45 minutes to an hour of all the questions that you have. And then, of course, John, that software that you have, which will you make sure that people understand there are a lot of controversial diets out there that say this is low histamine where it's really not. So we have the ability to print out an awesome printout for you in terms of a shopping list to be able to go to the grocery store, and these are the foods that you're looking at. And then, of course, running your own genes, submit that to us, and Dr. John will produce a top 10 gene SNP based on your genes, which will have the ABP1 and the AOC1, which is really awesome. And really, you know, tonight's the deadline for the reduction in price. The course is really valued at, you can't put a value on it, but we're pricing it at $695. We launched this last Tuesday, and we gave people a week to get in at $395, at $300 off. So tonight is the deadline for that, 11:59 with 59 seconds and a half. You miss that deadline and it's going to go up to $400 starting $499 tomorrow, $495 tomorrow, and still a great value. But we'll leave the link here, and then of course wherever we're posting this, we'll have other links to it. Who's ever, you know, media we're posting it to. So other things that you want to add to that, John?
No, not. You know, I think you covered everything. I know there's a couple questions that came in. You know, I don't know if that's something you want to address or if you want to kind of respond to them after the fact, or.
Yeah, so when we're doing Facebook Live from Zoom, I don't see the questions, but when we are doing the Facebook Live through Zoom for the password protected attendance, we will be able to see the questions real time, but we will go back once we post this and answer the questions that you guys have afterwards. And just super excited. I really feel that this is not just going to explain the deal breakers for you and what's the deal with you getting your health back, but the deal breakers in this whole MTHFR genetic arena of why am I not moving the needle as much as I need to when I've already crossed MTHFR the list and I've taken care of it. And we're like, well, wait a minute, you haven't. And I think that the bigger purpose is really to educate not just the patients, but the healthcare profession to be able to put together new algorithms. Hey, like leaky gut's not just about removing gluten. Leaky gut has this huge rabbit hole called histamine, and histamine has this huge rabbit hole called genetic predispositions, environmental toxins, chemical exposures, foods, alcohol, stress, infections, and all of those things are going to create a leaky gut. And it's not enough to just to get off of the grains and expect that to be a magic wand. So I think this is awesome. Want you guys to take part in this, save another $100, get in tonight, and we really look forward to you know, helping you recover from your exhaustion nightmare that no one else is helping you with. I think that's an awesome thing for us to help you with. So I think we'll do another one of these next week, John, and we'll figure out what topic we want based on the questions we have. And thanks so much for being the leader that you are and bringing this stuff. I have to admit, I did the DAO thing. Like I'll admit it, like, yep, you don't have the DAO SNPs. So let's not necessarily go down that route. But then all of a sudden this new AOC ABP1 comes out and I'm like, oh, maybe I was telling people, you know, not the whole complete picture. And I think you have to be humble in this field, John, where you get more pieces of information that will make the difference for someone's life. And you have to go down some of those wrong paths to know that, oh, hey, there's more here than meets the eye. And that's what this course is doing. And the other thing I would say lastly is that once you purchase this, it's a lifetime purchase. And John and I will be making updates to the new pieces of information that come out, and you guys will be continuing to get updates updated with your version so that you're always ahead of the game and knowing how these genes are now giving us new pieces of information that moves the needle even further. So super excited to be offering this. Get in on it now, and we really look forward to getting your health back. And have a great evening.